Well, good afternoon, everyone. Thank you for joining us today for the first ever healthcare innovation series. We had this idea over a year ago to start doing something similar to this, where we would invite local leaders, folks from the business community, into the hospital and talk about innovations in healthcare that might help to improve quality and reduce costs for our local employers. And then, of course, COVID hit, and we weren't able to invite people into our building and kind of had to put all of this on hold for a year. But we're happy to bring it back today in a video format, and hope that this is something that's useful for you, and hope that it's something that we can try to do on about a quarterly basis here, and maybe eventually can get back into doing these in person as well. But certainly appreciate you being on. I'm Brian Stevens. I'm the CEO here at Door County Medical Center. I have several guests with me today. Sitting beside me here is Dr. Andre Kurek. Dr. Kurek is a family medicine physician here with us at Door County Medical Center, and is also trained in sleep medicine, and he's going to talk to us today about sleep disorders. I also have on the line with us today Josh Gustafson. He's the Director of Business Development and Strategic Partnerships at Prevea Health and with HSHS Wisconsin. And Josh is going to talk to you about some options for you in terms of reducing workers' comp costs and being able to get people essentially the care that they need on demand there at your work location. And then we'll give some general DCMC and Prevea updates, and generally would offer a Q&A, and if we have time to do that today, we'll do that as well. But again, I want to thank you for tuning in, and hopefully this is helpful for you, and do give us feedback as we want to improve these as we go into the future. So what I'll do is I'm going to bring up Dr. Kurek's presentation, and then I'm going to turn things over to him. If along the way, if you have any questions and you want to type those into the chat, we're happy to answer those questions as they come up. So please feel free to do that. All right, and Dr. Kurek, here is your presentation, and thank you for being here today.
Yes, thank you for inviting me. This is a nice opportunity for us to share what we do, meaning Dr. Hogan and myself. And we'll see the monitor on the side there a little bit.
Yep. So yeah, what you can do to advance the slide is just hit the right arrow.
No, I mean, but seeing the folks on the side there.
That's just us. The folks listening won't be able to see that.
Oh, okay. No, okay. If it interferes on the slide there.
Yep, we can reduce it. So
yeah, just kind of so you can.
Yep.
There we go. Perfect.
There you go. Yeah, you bet.
Okay. So first we'll start with the introduction of the sleep facility. It was started in 1993. Dr. Hogan joining. He had been already practicing for 3 years. Then Nancy Ruff, a respiratory technician, joined Door County, and she had experience as a sleep lab technician and respiratory technician, and she was instrumental in starting the laboratory with Dr. Hogan. Dr. John Stevenson joined from St. Vincent's, and he also was very instrumental in setting up the laboratory. And he did also start other laboratories in the area, so he's a well-known figure. Dr. Hogan got his board certified in sleep medicine in 2010, and myself in 2011. I joined 2008, and also was very interested in sleep through my medical career. So why is sleep important? Adequate, high-quality sleep is necessary for performance and sense of well-being. And we can spend a whole couple hours just discussing this whole point, but we try to summarize here, and we'll go. And I hope to later get questions and maybe answer any, even in email forms. It's good to do. So numerous problems can interfere with sleep. The actual incidence of sleep problems depends on the definition of that. So we won't go into specifics, but I can tell you roughly 30% of Americans, all U.S. population, has sleep disorders of some sort. In a 24-hour busy world, disrupted sleep is not a minor problem, and we'll go into that a little bit here. Some problems with sleep is due to inadequate sleep time, sleep disorder breathing, insomnia, and those seem to be the most common problems that we deal with in the laboratory and in the clinic. This slide shows the normal stages of sleep throughout the lifespan, and it's no surprise newborns need nearly 24 hours of sleep, and we can see in an adult population, on average, 7 to 9 hours, with up to 11 hours, and as short as 6 hours. There are people who are short sleepers, and they can get away with 6 hours. There's not many of them, but they're out there too. This slide was really for this presentation, specifically with the business leaders. This was the sources from Frost and Sullivan 2016 white papers, Hidden Health Crisis Costing American Billions. And really, the slide encompasses it nicely because it's an iceberg, and we're seeing the tip of the iceberg, really. As you can see, only 80% of sleep apnea patients, which is a majority of sleep problems, is only being, well, I should say 20% are only being treated, and 80% are undiagnosed, which is huge. The direct economic consequences are from comorbidities like high blood pressure, diabetes, motor vehicle accidents, workplace accidents, and the maladaptive behaviors to these sleepiness and symptoms, such as substance abuse of drugs, tobacco, and alcohol, and sleep pill abuse. Indirect economic costs include decreased productivity at work, reduced quality of life, stress, interpersonal relationships. Lately, we've been seeing a lot of that in form of insomnia and dissatisfied marriages. People are cooped up a little bit with the pandemic, and patients have been coming in relating that to us, and that's a little bit challenging, but it's part of what we do. As far as work productivity and sleep disorders, there was an interesting, on the side note here, that there was a root cause analysis, a major study worldwide to see major world disasters with that happened, and they did a root cause to see what was the underlying driving factor. And for example, Valvey's oil tanker, Chernobyl, 3 Mile Island, major world and Challenger, and they found guys at the controls sleepy and making errors and mistakes, which is.
Yeah, I was reading this month's issue of Fast Company magazine had some statistics in it about sleep, and they claim that 38% of adults report unintentionally falling asleep during the day at least once in the preceding month. I mean, if you think about that from the workforce, a third of your workforce unintentionally falling asleep at any given time.
It is a scary thought, and we'll go into that a little bit here too with some of the things. So the work productivity, which by their definition is absenteeism, underperformance, negative workplace behavior. And what's interesting with this one, they looked at with treatment, for example, for sleep apnea, that there's a decrease in absenteeism by 1.8 days per year, and productivity increasing by 70.3% on average, which is huge. 31 participants in this study had fewer alcohol drinks, 62% smoked less cigarettes, and 21% used fewer sleeping pills after they were treated with sleep apnea. Hypertension, so 3% on pills were able to get off pills, which is huge for us when we're trying to tackle this problem. And 17% were able to decrease their pills, which is also huge, because it seems like as time goes on with a lot of folks, we'll see if we don't address this, the problems are only going up and up, and we are not able to bring it down easily. And with diabetics, there's less hospitalizations by half once sleep apnea is addressed and treated from a hospital point of view. But on the workplace, yeah, I mean, it also affects everything. We know sleep apnea directly affects diabetes and sugar control at night. And we'll see that morning surge in the morning where sugar is high. And patients are often saying, well, I didn't eat anything. How come my sugar is high? And that's because there's inflammation and breath holding spells, which cause sugar to go up. But with treatment, it goes down. Now, sleep apnea contributes to both work disability and decreased productivity. Even a simple 1 hour of sleep loss that we'll see in daytime savings changes can result in cyberloafing. I actually had to look that up, and that's using the internet on a job site for your own pleasure, not necessarily to the job. Poor decision making, decreased productivity, lower likelihood that a colleague will help. I mean, individual will help a colleague, which is interesting too. We become kind of selfish that way. So some companies focused on sleep disorders in their employees in hopes of helping. And what they have seen is substantial cost savings by reducing absentees, better management of comorbidities like high blood pressure and diabetes, and increasing productivity. In a study of 506 patients that were treating sleep apnea, they had 40% decline in workplace absentees, and again, 17% increase in productivity. Some examples of companies that looked actively in addressing sleep apnea, a form of sleep disorder, the AAA Foundation, Aetna, Google, Concerta, Humana, Huffington Post, Kaiser, Schneider, and UPRES, which is Union Pacific Railroad Electronic Health Services, I believe. And we'll go into a best practice here with Schneider, which is actually a large U.S. and China trucking logistic company. And they basically, in their line of work, a trucking accident is basically $500,000 per accident. So they looked into containing those costs, and basically they acknowledged that there's a link between driver fatigue and sleepiness and impact on performance. So they, in a sense, have been paying their employees to get evaluated and treated for sleep apnea on their own, out of their own pocket. And they found from their 2,700 drivers on the CPAP, they all had follow-up appointments in their 35 clinics around the country, which is amazing that the company invested and diagnosed and treated their own employees and had coordinated with sleep facilities under one umbrella to treat these guys. And they found 73% reduction in preventable driving accidents with CPAP treated employees. Humana and various insurance companies have been creating educational programs for employees and tools such as self-assessment of their symptoms and incentive programs if they are compliant, because they realize that it not only takes the doctor doing his thing, it's the whole company has to be supportive. Here in Door County, we've been screening patients on a regular basis during preoperatively, during hospitalizations, during annual preventive visits. We ask the questions to screen. We offer screening tools, and we are in the process of developing a multidisciplinary weight loss program that will also focus on sleep issues. As we know, obesity will affect and cause sleep apnea as one of the problems. So some opportunities that we're doing.
So it sounds like just like some of those companies who have taken matters into their own hands and say, we need to screen our employees, we're trying to do that with patients. When we see them in various settings, we're trying to use that as an opportunity to screen them for sleep problems as well.
Exactly. And I think the key thing I get a sense from reviewing this is that the companies who do better, who do look into these problems, they are actually on the forefront.
Right.
Recognize.
And we want to welcome Dr. Rich Hogan to the conversation too. Dr. Hogan's one of our internal medicine physicians and is also, as we said earlier, board certified in sleep medicine. And so he and Dr. Kurek partner in this area.
Sure. So to the tip of the iceberg, work productivity and sleep disorders. So estimates are that untreated sleep apnea in U.S. Results in a loss productivity of up to $86 billion in 2015 alone. And there's a strong chance there are workers affected by this disorder at your work site if it's been looked for. So again, I would, for anybody who's interested to look at these papers, there's just Google this site and Frost and Sullivan 2016 white papers. They have all where we got this data from. I will head to Dr. Hogan.
Hello, everybody. I'm sorry that I'm late. I was seeing a sleep patient in clinic.
Just press the down arrow, Rich.
Okay. So what do? When we see patients, we may get a referral from another physician or nurse practitioner. Sometimes we get referrals from outside providers that are not in our system, too. And we begin with a history and physical. We try to find out, well, what's going on with sleep and what's the next step. And if the patient's not allowing enough time for sleep, we emphasize the need for people to allow enough time in bed. And that's one of the major reasons for sleepiness in our country is that people don't allow enough time. And then we evaluate for other issues that may be preventing quality sleep. And the common problems we see are inadequate sleep time, which I mentioned. Insomnia is a fairly large issue that's oftentimes unaddressed. Sleep disordered breathing is what Dr. Kurek has been talking about, the sleep apnea patients. And there are also some drugs that may interfere with sleep, like alcohol and certain prescription drugs, and also illegal drugs. So we try to get a bead on what's going on with the patient in terms of those issues. Effective treatment of these problems is necessary for your employees to be on their best game. Insomnia, the diagnosis of the type of insomnia and use of behavioral treatments that include teaching patients techniques for good sleep hygiene. There's something called stimulus control. It's about creating the right environment for sleep. We often do teach patients relaxation techniques if they're high strung and they can't get to sleep because they can't turn their mind off. Sleep restriction is something that can be done. It's not often done. It's a difficult way to treat insomnia. And then there's something called paradoxical intent, where instead of having the patient try to sleep, we think that they may be trying too hard and maybe they should try not to fall asleep. And believe it or not, it does work sometimes. Cognitive behavioral therapy for insomnia is kind of a combination of the above, and there aren't that many therapists in the country that are doing that yet, but it's supposed to be a very effective measure to treat insomnia. Medications for sleep, we use these particularly if there's a psychiatric illness as a cause, such as depression or severe anxiety disorders. Then there's the sleep disorder breathing that Dr. Kurek has been talking about, and there's two main types, which is the most common is obstructive sleep apnea, which we treat usually with a CPAP or a BiPAP machine, and then there's something called central sleep apnea. It's less common and needs a kind of different approach. But the vast majority of people we see have obstructive sleep apnea. Obstructive sleep apnea occurs because of upper airway obstruction during sleep from loss of pharyngeal muscle tone, obesity compromising the airway, and sometimes anatomical factors, the facial structure being an important factor here. If someone has a real recessed chin or recessed cheekbones, that can cause predisposal to sleep apnea. And in some studies, more than 30% of American adults have some degree of sleep apnea. And of course, it's a continuum. It's not a yes or no. It's normal, mild, moderate, severe. We do use something called an apnea screener that the patient can take home to get an idea of whether there's a problem or not. It's very easy to use, and actually, I believe we offered at no charge as a screen. Also, we can do home sleep studies. Not everyone has to come into the lab for a sleep study. We can do quite a bit at home, particularly if the patient doesn't have heart or lung problems. And the last is the in-lab formal overnight sleep studies, where they come up to the hospital and they get wired up and we look at their brain waves, we look at the whole thing. These are at times very essential to find out what's going on with sleep. Symptoms and signs of sleep apnea: loud snoring, witnessed apnea by the bed partner, excessive daytime sleepiness, excessive fatigue, poor work performance leading to loss of employment, cognitive dysfunction, irritability, depression, and difficulty with personal relationships.
Rich, I was going to just add here that
sure.
A lot of patients that will come in will interestingly not say they're tired, and really they're not tired. And this is where a lot of physicians may miss sleep disorders because the patient is not complaining about being tired. Sometimes we may use other ways of ferreting out information out of them, but a lot of times the patient will have something like hypertension, will have arrhythmia, and that alone tells us more than likely this patient already has a sleep disorder that's feeding into this problem, and diabetes and strokes and memory loss. Mm-hmm. So, the confusing part a lot of times is that excessive days does not have to be there. In fact, half the patients may not even be tired, but yet they have a severe case, which is very interesting.
Yeah, that's a good point. I mean, it sounds like, we talk a lot about diet and we talk a lot about nutrition, but sleep is kind of the third leg of that stool that I don't think we talk about that much. Mm-hmm. That even if it's not causing you to feel tired during the day, if if you're not having high quality sleep, it could be leading to other health problems.
In fact, people that don't sleep well eat more.
Yeah.
There's fairly good evidence in the literature of that. If you don't sleep well, you eat more. You're hungrier. So this is just a cartoon of a patient cutaway, and it's showing at the bottom there where the choke point is. It's kind of in back of the tongue and below there, where during sleep that collapses and causes the apnea, or the apnea would be no flow of air, and there is a hypopnea, which is very shallow flow of air, which impairs the oxygenation of the blood. So this is a person with a home study, and it's showing in the background an EEG, and the red is the EKG. And if you look down below that, there's an apnea. There's no flow. And this would be a central apnea because there's no effort either. The patient's not even trying to get a breath. So this is something we do see sometimes, central sleep apnea. And then this is a hypnogram of what we look at after the sleep study. There's quite a lot of information, and I would like to have you look at the purple boxes there. Those are obstructive sleep apneas with arousals. And if you look after that at the red line below it, that's oxygen level. So the oxygen desaturation occurs shortly after the event because it takes a little while for the blood to get through the heart and back into your finger where we're actually measuring the oxygen level. Treatment is usually CPAP. Other things have been tried, but this is sort of the go-to treatment right now. It's continuous positive airway pressure. It's the mainstay for most patients. It actually acts as a physiologic stent, so it keeps the airway open even though the airway would be prone to collapse and cause an apnea or hypopnea if it wasn't a complete collapse. So the flow of air stents the airway open, and the patient does not have an event and sleeps through it. There's something also called BiPAP, which is a different machine. It gives two different pressures. It gives a pressure when the patient goes to get a breath, and then it lowers to a pressure that keeps the airway from collapsing. And certain patients that need high pressures do very well on BiPAP. Since we have a small program, we can offer highly individualized evaluation and treatment for patients. And our sleep technicians are the backbone of the sleep lab and are very committed to providing excellent care. And we have a very good compliance rate at 1 year. Other people we talk to tell us that we must be telling a fib, because it's one of the main things is to try to get people to continue to use that, and our 1 year compliance rate is very good. I'm going to turn this back to Dr. Kurek.
Yeah, so we throw this slide in here as it really demonstrates this is a sleep architecture hypnogram. Like, it's basically looking at the whole night, and on the left side we see a patient who's not treated. I don't know if I can move this arrow here. Here, this is the point where treatment was started with CPAP, and what I wanted to point out is there's a lot of hypopneas, which is a type of apnea with interruptions. There's arousals here, which each line representing the brain is arousing and falling asleep multiple times. And this patient has a hard time forming REM sleep, and it's fragmented sleep. Oxygen is critically going down into their 40s. You know, if somebody here sitting here was in their 40s, we would rush you to the intensive care unit, put oxygen, try to do anything to get that oxygen up, but people are doing it at night. And we see heart rate variability. In fact, a lot of patients will go into the arrhythmia at night, and we'll see atrial fibrillation and other things. And as soon as this patient was treated, immediately everything corrects. This is a perfect example of what we do. And we'll frequently see these cases, and we are very pleased because this person has a very nice, REM sleep, oxygen, arousals go away. And this guy was a happy camper. He's actually a patient from our clinic. Amazing story, feeling better and probably working better too.
So this is just an example of somebody with one type of a device that goes over the nose only. There are many different devices that people can use. This particular device, again, is a nasal device. And usually if we work with people, we can find some type of a device and interface that will allow them to sleep and to do well. Sometimes it takes quite a bit of working with patients to find the right type of interface. So the testing array that we have at Door County Medical Center, we have sleep screening in the clinic, questionnaires at annual or preoperative visits. We have the availability of sleep medicine consultations with myself or Dr. Kurek in person and also on telemedicine. We have the apnea screeners that the patients can take home that are actually free, just to get people to sort of buy into it. It's very helpful sometimes to convince patients that they have an issue. Another test is simply overnight oximetry, where the patient wears an oximeter overnight, and we can see where their oxygen level is dipping. It may be back and forth, up and down, and that also can be quite convincing. We have the home sleep testing that is available and can be very helpful. We try to limit this to patients that don't have significant heart or lung disease. Those patients are better off to be seen in the sleep lab with a formal overnight polysomnography in our sleep lab. And any questions that people have can be directed to the sleep lab at 746-3570. More on treatment. As time has gone by, the treatments are getting better and better. When I came into sleep medicine quite a number of decades ago, we were told not to use CPAP because the masks weren't right and they were making big ulcerations on patients' nose, the bridge of the nose, and of course that problem was quickly fixed. And the mask interfaces have greatly improved over time to make them much more comfortable. And we also now have auto-titrating PAP machines that we can set at a range of pressures, and the patient can take those home and be treated by that, and then the equipment can give us information about how they're doing with it, the utilization, how much they're using it, and also whether the equipment is effective in improving their apneas and hypopneas. And I do know that for having done this for a long time, some people, this treatment can be life-changing. I have had husbands have come to me and said, thank you for giving me my wife back, because they were so under the weather because of untreated sleep apnea that there was this marked change in how they functioned during the day and how they related. And I think that was the gist of what we had to say. Dr. Kurek, do you have anything else to say?
I was going to say that with the auto-PAPs and the today's technology, just to enforce that point that you made, that we have a feedback, and I think this is the forefront of medicine where we actually see how the person is doing per night, with how many apneas they have, with how if they have a leakage of air, and we can adjust the settings almost live, night to night. We can program and a patient is very grateful as they are able to see themselves syncing with the smartphone. They get congratulation texts. They have all these when they're doing well, and we get feedback on that too. So that's in today's world is amazing how that technology has changed.
That's great.
Yeah.
Well, hey, I really want to thank both of you for taking time today to be here and to share this information. And I'll go back up one slide, I think. If I can get there. Here we go. Just back to that phone number. So if you're out there, if you're an individual who has questions about this and feel like you'd like to be screened, then, certainly you can just call our clinic and set up an appointment with your primary care physician or with Dr. Kurek or Dr. Hogan to talk about that. If you have general questions, or if you're a company that's interested in the screening program for your employees, the number on the screen, 746-3570, is our sleep lab, and that would be a good place to start with those. So, again, thank you very much for your time today. Certainly appreciate it.
You're welcome.
Be very careful with the cord as you leave here.
Yes.
Thank you.
Thank you for your attention.
Yeah.
All right. Very good. Well, we'll move on now to Josh Gustafson. Josh is here again with Prevea Health in HSHS, Wisconsin, and he's going to take it away from here. Thank you, Josh.
Yeah, thank you, Brian. And this is a great transition from Dr. Kurek and Dr. Hogan's presentation. You know, everything they spoke about, especially for those truck drivers and the transportation companies out there, that could mean, you know, the ability to provide services for you or not provide services for you for those drivers and losing their card for an extended period of time just because of sleep apnea and sleep issues. So I highly encourage you to look at that if you have any type of DOT requirements within your place of business. And I'm going to lead into occupational health and talk a little bit more in depth about some of the services that are offered right in Sturgeon Bay for occupational health. So I'm Josh Gustafson, Director of Business Development for Prevea and HSHS, but very ingrained in Brian Stevens and his Door County Medical Center team. And a big part of that is occupational health. The clinic right across the street from Door County Medical Center's the hospital is the Prevea Health Occupational Health Clinic, and we work as one in partnership with Door County Medical Center. We cover a lot of different services, as you see on the screen here. I'm going to really focus on one in just a moment, but I wanted to make sure everyone was aware that we have a provider there full-time now. There is a provider who can do work injury treatment and management, work injury prevention, reduction, education, on-demand appointments, pre-scheduled appointments, and we can even manage work comp cases for you. So with the capabilities of imaging and lab right across the street, having a provider, a dedicated nurse that specializes in occupational medicine right there in town, you have everything you need without leaving that location in that area. Secondary to that, and just as important, are therapy and ergonomic services. And when we're talking about workplace injury care, the first thing that should come to mind is prevention. Preventing those injuries from ever happening. And if an injury does happen, make sure that you have the resources to get immediate care and to get affordable care. But the Door County Medical Center therapy team has one of the most robust and experienced industrial physical therapists that make up their employer services team. They're working on site at companies, ingraining themselves into that culture, making sure that they're observing and monitoring individuals working machining lines, working shipyards, and working across the various plants to prevent injuries. They look at body mechanics in a completely different way than I could probably even understand myself or explain. And so if it's something that you're interested in, and having someone come on site, even if it's just a quick evaluation, you know, maybe you're a school district and you have bus drivers and you're starting to see shoulder or neck injuries. You know, what are the lifting requirements for that job and for lifting the hood and moving things around? That's something that they do, and they do exceptionally well. On top of that, those physical exams, pre-employment screenings, DOT physicals, and even vaccinations that might be required for employment, that can all be done right there at one location. We also have an extremely robust drug screening and management program where we will handle your complete drug pool management if you'd like. A random drug pool management, you can turn the census over to us and we can manage that for you at no additional cost other than the cost of the actual drug screen. We'll do specimen collection and testing right there on site or at our clinic. We also have 5 medical review officers. So in most cases, when you're talking about pre-employment or post-accident drug testing, it's going out to a national company who's utilizing a smaller pool of MROs. At Prevea Health and Door County Medical Center, we employ 5 ourselves. So your response time in getting the results for those drug tests is extremely fast and it's accurate. Talking a little bit more about the PT and the physical therapy on site, again, it goes back to, it's not just intervention or treatment after an injury has happened, but as you can see on this list, these are things that the physical therapists do, and they do exceptionally well. They'll even work with your HR team and go out across your plant, your company, your floor, and they'll measure and take a look at what is the actual physical requirements of the job at hand and make sure your job descriptions match that. So you're not hiring someone into a position where they physically aren't able to do that job. That's the last thing that employee wants, is to be struggling every day and then know an injury's coming. And that's the last thing you want, is to have somebody who gets injured right out of the gate and then we're working through that that injury case. And so they'll help and work with your HR team in crafting those job descriptions. And then ergonomics and movement screenings throughout their time on site. So it can be a one and done service, an annual review service, or, as I said, we can put a physical therapist on site on a regular schedule working at your company. But when an injury does happen and somebody does get injured, you already know where they need to go. Unless you are one of those amazing companies who have not had an injury in 4 or 5 years. I think there might be a few out there. You know that you've got the walk-in clinic, urgent care at Door County Medical Center. You've got Door County Medical Center emergency department as well. But what about those times when it's not really an ER-worthy visit, or the urgent care clinic isn't open? Or even the urgent care clinic is open, but as an employer, as a safety specialist, this might not actually need clinical care other than first aid, or the employee thinks that, but they just want reassurance from a provider that says, you know what, that cut, it's minimal, it doesn't need stitches, let's walk through some first aid and you're going to be fine. So we at Prevea Health created a new telemedicine service called Prevea Injury Care on Demand, or PIC. It provides you with 24 hours a day, 7-day-a-week access, 365 days a year, 15 minutes or less. You'll have access to an occupational medicine provider Monday through Friday, 8 to 5. On the evenings and weekends, you'll have an APP trained in occupational health. And then on nights and holidays, you'll have a registered nurse who is specialized in occupational health, who will actually lay eyes on that injury. So we're not talking a telephonic service like everything that's currently out there in the market. We're talking about your employee sitting down in front of a computer and live having an interaction with a provider over a high-def camera, who then they can decide, is it going to be first aid and we'll get them patched up and they can go right back to work? Or is this something that they do need to come in for? Probably more importantly, if they do need to come in, can it wait or should it wait for an occupational health visit? Because as you know, seeing a specialist is by far one of the most important things you can do for a workplace injury to make sure that person comes back to work in an expedited manner. And occupational health is a specialty. So if someone's injured after hours, second shift, third shift, and it's not an ER-worthy appointment, then great, let's get them scheduled with Rich, the occupational health provider, right there in Sturgeon Bay, first thing in the morning, and then he can take care of that injury right on the spot. So how does it work? It's pretty simple. As long as you have a room, you have a computer in that room, a telephone, and then preferably a nice deluxe first aid kit, that's all you need. We can come in and we have signage and posters. We do regular supervisor and employee education. We'll handle all the training. And when an employee is injured, they should follow your normal policies that are in place. First thing, finding their supervisor, HR, or a safety officer on site and reporting that injury. From there, they can work with that individual to determine this absolutely needs to go to the ER, or this is something we can do through a telemedicine consult really quickly right here on site. They walk into the room, they pick up the phone, and they place a call 24 hours a day, 7 days a week to a dedicated phone number where they will schedule that appointment. They'll let you know which provider is scheduled with, and then they'll tell you turn to the computer. Click on the button that we'll work with your IT on and creating on the desktop, and answer a few questions, and then there you are. You're in the appointment with that provider. During that entire appointment, the provider is documenting right there in the medical record system and also creating simultaneously that return to work slip. So you no longer have to be chasing down return to work slips, treatment plans for those employees. You're not left in the dark. Our providers will actually ask you, the safety specialist or someone from HR, to come back into the office once the appointment's done and have a three-way discussion about here's the next steps. Do they need transportation to Door County Medical Center? Can they go right back to work after the bandage is on and secured and kept dry? They'll walk through that with you, and then usually in a matter of minutes, if there's a printer connected to that computer, you can print out that return to work slip and that treatment plan for the employee. Everything is done right there on site in one episode of care. The charge rate is a flat $55 for that visit. There is no per member per month fee, subscription fee. Hopefully you never have to use it. If you go a year without an injury and you never use it, you don't have a bill. There is no billing, no reporting sent to you. But if there are injuries, you'll get a bill and you get that reporting. And it's also important for us and you to understand, are we seeing 6 injuries to left shoulders on this specific line in our factory from different people? Maybe we have an ergonomic issue. Maybe there's something we can do to prevent those, and we look at those as well. The service, of course, the benefits of the service: reduce unnecessary ER visits. The last thing the emergency room physicians at Door County Medical Center want to do during this time when we're going through COVID and everything else is happening and people truly need the ER is to have someone waiting in that waiting room behind everyone else when it may or may not be an ER-worthy type appointment. So making sure that your employees are getting the right type of care at the right time is a focus and a goal, and it will be a success of this service. Also, reducing those avoidable OSHA recordables. The last thing that will happen is a prescription order when one's not needed. If it can be done with first aid through that appointment, then of course, as you know, and those who understand safety and HR language, that's not a recordable. If there's no script, the person doesn't have time actually off of work and they didn't have to go to a medical facility for treatment, then that's not an OSHA recordable. Of course, 15 minutes or less, right there at work, they get the care, and then you receive that paperwork. These are just a couple examples of things that are provided complimentary. If you want door signage done a specific way, we can do door signage for you at no cost. And then on the right, you see an example of one of the posters we've created for a company. We have several different options that if your employees and your safety officers or managers have never seen the service before, if they walk in the room, they follow the poster step by step, they'll have the appointment completed. And here's my contact information. If anyone has any questions on this service or anything else occupational health or employer services related, feel free to call me or email me at any time. You can also reach out to Brian Stevens and his team. We meet and talk on a regular basis. And of course, with the services that co-blend between us, we're interacting daily. Thanks, Brian.
Josh, thank you so much for that. And we just so appreciate having you all as a partner here in our community. You have such a robust number of tools and services available from an OC Health standpoint, and we're just happy to be able to offer that to our community through the partnership with you. So thank you again for joining, and appreciate you sharing that information. Just a reminder to those who are on the call, if anyone has any questions that they want to type into the chat, we can answer questions that way, and it can be interactive in that way. But for the sake of time, I am going to move on to just some general Door County Medical Center updates. One of the things that we are working on that I'm really proud of our leadership team and of our board of directors, as we're coming out of the pandemic, we're starting to think about what's next for our community and where do we need to be, what types of things do we need to be doing to continue to serve our community in a meaningful way. One of the things we've learned over the last year is that the health of our community is incredibly important. And certainly this whole pandemic could have been worse in Door County were it not for the case that we are an active community. We're a community that cares about health, but it is something that we want to emphasize going forward, and we want to make sure that Door County Medical Center is a driving force to help inspire people to be healthier, to help put policies in place within our communities that can help to create health and healthy spaces. So I wanted to talk a little bit about that today, and then I'll expand on it the next time we get together as well. I do have a presentation that I'll pull up here as we start to talk about that, and give me just a minute. So as we talk about community health, one question that is kind of an obvious question is, how do we define it? Community health is kind of a broad term. How do we know if our community is healthy? One thing that we say here at the hospital is, how do we know if we're winning or losing? And that would be the case here as well. Is it illness rates that we look at? Is it access to healthcare that we have in the community? Is it, do we monitor people's physical activity levels or how well we eat as a community? Those things are hard to measure. And also, how does our community compare to other communities within the state and around the country? Well, one of the things I want to introduce you to is called County Health Rankings. And here's kind of a video that's going to introduce that for us.
We all have a role to play in shaping our community's health. There are so many factors that influence how long we live and how well we live. Think of all the things that affect our health. Sure, we could all eat better, move more, and make sure we get our annual checkups. But there's more to it than that. The quality of our homes, the safety of our neighborhoods, and our chance at a good education all influence health in the short and long term. But how can we understand how all these things fit together? Meet the County Health Rankings Model. The model illustrates a broad vision for health. The model shows us that policies and programs play an important role in influencing the health factors that, in turn, shape a community's health outcomes. That means not just how long we live, but also how well we live. Health is complex. The County Health Rankings Model helps us see all the factors that impact health and understand where we can take action so everyone thrives. Visit countyhealthrankings.org to get started.
So the County Health Rankings, as it said, is a website that we're learning to use as a tool really to measure how healthy we are as a community and what types of things we can be doing as a hospital to help improve health within our community and things that we need to partner on. The County Health Rankings program is a program that was developed by the University of Wisconsin Population Health Institute, but it's something that reaches broadly across all the counties throughout the United States. They're measuring the health of every county in the United States, even though it was started here in Wisconsin. You can see on the presentation, it's also supported by the Robert Wood Johnson Foundation, so it is a nonprofit effort. So there's not big companies behind it who are trying to sell us things. This is something that really is a very nice objective measure of community health that, again, like I say, we're learning to use as a tool. So what's our next step as a facility and as a hospital as we look at this? We have to learn that we can only do so much. In fact, if you look at the model that was in the video, you'll find that it's actually social and economic factors that most influence the health of a population, things like the education level, the employment level, folks' income, community safety. Those are the most important things that determine the health of a community. The next most important things are health behaviors, and those are very individual. As an individual, are people dieting and exercising? Are they abusing drugs and alcohol? Are they smokers? Those sorts of things also impact the health of individuals, obviously, and the health of our community. And it's not until you get past all of that you get down to clinical care, which at Door County Medical Center, that's what we have direct control over is clinical care. But it only makes up 20% of an individual's health and really 20% of the population's health as well. So here's another video that kind of explains that in more detail.
What makes a community healthy or unhealthy? You might think it's what happens in a hospital or a doctor's office. But that's only a small piece of the puzzle. The County Health Rankings are grounded in science. Many factors matter. Clinical care, whether we have access to good doctors and quality health care when we get sick. Our health behaviors, like whether we smoke or have the opportunity to eat healthy meals. But also social and economic factors, like education and income that heavily influence whether we have the opportunities to be healthy. And the physical environment, like whether we have clean air and water, as well as safe and healthy homes, and the means to get to places where we need to be, like jobs, childcare, and stores. The rankings put all this together to provide a new way to think about health in our communities. And with this knowledge, Each of us can help build a culture of health, county by county.
So again, we have to learn at Door County Medical Center that even as passionate as we are about the health of the community, the things that we do in our building really only impact 20% of the health of an individual. And so that means we have to get outside of our four walls and we have to partner with others in the community, and that we're really, what we do and what we're trying to achieve is interconnected with local business, with education, with public safety, all sorts of other organizations in the community that can help with this. And so we have to make sure that we're factoring on, or that we're focusing on the actual health factors to improve the health results. So if we talk about the results a little bit, on the website, those are called health outcomes. And when we think about health outcomes, you can see that they define those as two things: length of life and quality of life. And you think about those things within our community, again, that's hard to measure. It's hard to measure the quality of people's lives. We feel like we have a high quality of life here in Door County, but we only want to improve that, and we certainly want to improve the length of people's lives who live here. And so I'll show you one final video, and it's a video of a community out in California called Loma Linda, and some of the things that they've done there, and some of the success that they've had with this type of a program.
A gift of time, a fitting name for a clock shop located in Loma Linda. People in this Inland Empire enclave 70 miles east of LA see more new days than practically any place else on the planet.
Hi.
Benita Welliver is 100, a spring chicken compared to her neighbor Betty Streisling.
I feel great.
Betty's 102. Lots of communities have centenarians, but Loma Linda is a so-called blue zone, designated by National Geographic as one of the 5 longest living communities in the world. The average life expectancy here is anything but average.
Mine would be about 89 years.
Dr. Brian Bull is a pathologist, blood researcher, and former dean of the Loma Linda University Medical School.
Now, being male automatically shortens my lifespan by about 2 years. Nothing I can do about that.
But in Loma Linda, the average man makes it to 89, compared to the national average for men, which is just 78. The average woman here lives to 91. That's huge.
It is huge because for the females in the general population, it's about 81 years.
But Loma Linda is not a general population community. There are different values and a different lifestyle here. A lifestyle based around the Seventh-day Adventist Church.
We're thankful our Heavenly Father for this new day, for this good food. When it became obvious that Adventists were living a lot longer, even the federal government got curious as to why this might be the case.
Here, the body is a temple. A typical Loma Linda breakfast isn't bacon and eggs. It's hot oatmeal or granola, spiked with flaxseed, nuts, and plenty of berries. This spin class at the local fitness center is as fierce as it gets, and the regular riders are all over 60.
I'm 65.
63. 75 years old.
Dr. Bull says fitness, science, religion, they all work together in his hometown. Among Adventists,
science has always been looked upon with approval,
but never at the expense of being observant. Come here any Saturday, the labs are quiet, local businesses are closed, and you won't find much work going on, but you will find the chapel full.
Saturday, which is the Sabbath, we go to church and meet with friends and family.
Attention turns away from making a living. Instead,
more important things, where is your life going? Are you doing what you want to do?
The science hasn't proven whether observing the Sabbath on its own helps you live longer, but
that wouldn't be too surprising because I don't think the human organism is designed to work 7 days a week.
I had dark hair then.
Benita has no doubt following Adventist guidelines has contributed to her longevity, even if it means occasionally breaking the rules.
Like today, I had to have a bite of something sweet, And then I felt like I became sweeter myself in disposition.
Sweetness, too, may be a key to longevity, something Dr. Bull encourages in his 11-year-old granddaughter.
We're here to serve God, and we serve God best by serving our fellow man.
Which brings us to something universal among all the world's longest living communities.
Viewing your life as meaningful.
There's a lot to do if you're willing to do it.
So that's certainly something to aspire to. Wouldn't all of us love to say that we lived in a community that was known worldwide for the people there who live long, full lives? And you can see that communities like Loma Linda have found a really nice balance between certainly fitness and diet, which are the type of things that you normally think of when you think of health, but also to purpose and to connectedness. And the good news is that those of us who live in Door and Kewaunee counties are already well on our way to being able to achieve that. If you look at our actual results right now in county health rankings, what you will find is that both Door and Kewaunee counties are in the top quartile in the state of Wisconsin. And so what we're trying to do here at Door County Medical Center is we're trying to say, is that good enough? In what ways can we do better? So if you click on Door County right now, what you'll find, again, is that we are in the top quartile in both health outcomes and in health factors. And if you actually ask them to show the rankings, what you find is out of 72 counties right now, Door County ranks 7th in the state out of 72 counties. And so, and Kewaunee County is not far behind, if I can find it here, at 15th out of 72 counties. So this, the communities that we serve here are certainly off to a good start in terms of the health outcomes and the health factors that go into creating a healthy community. And we feel like we can be one of those communities that is known nationally and throughout the world for the health of the community. And so it's time to try to set a goal and get there. So as we have more of these chances to talk and to get together over the next year, what we'd like to do is kind of roll that out in each of these sessions and talk about some of the specific ways that we can get better to create an even healthier community. So again, I really want to thank you for your time today. I want to thank you for joining us, and hope that we can continue to do this on a quarterly basis going forward, at least for the next year. And again, we would like to be able to move some of these in person over time, but maybe the video format works well for folks as well. So thank you again for joining in today. And if you have any questions based on anything that you heard from any of us, please don't hesitate to call me, Brian Stevens, here at Door County Medical Center, and we would be happy to answer your questions. So thank you again. Thanks for the opportunity. Take care.